Now I would like to present the next speaker. The title of this presentation is Active Search for Importance and Experience in Peru. Right now, the speaker is going to be Mrs. Puma, who is a program coordinator in Peru for TB. Go on. Good morning.
Muy buenos días.
Good morning, everybody.
Bueno, muchas gracias también por la
Thank you so much
invitación
for
para
inviting me
presentarles hoy nuestra experiencia desde el
so
Perú.
I can talk about my experience in
Siguiente,
Peru.
por favor.
Next slide, please.
Bueno, desde Socios en Salud, nosotros
Okay,
nos empeñamos en llevar la
so
ciencia
we are
moderna hacia los más
focused
necesitados.
on taking
Esta nueva
medicine
tecnología
to the
quisiera
people who need it
centrarse
the
en el
most. This
colegio.
image that you are
Estamos
seeing now
organizados
shows
contra la
this.
tuberculosis, llevando la
This is
acción
our way
preventiva a través de
to
nuestra
battle
estrategia TB
TB
móvil o mochila TB
through
que
our
ya les voy a
strategy,
ir
which is a
presentando sobre
backpack
algunas de sus
TB that I'm
instalaciones.
going to show you in the
Siguiente, por
presentation.
favor.
Next slide, please.
Bueno, Perú se encuentra en
Okay,
Sudamérica.
Peru is in
Como bien
South America, as
observamos,
you can see
y
in the map.
lamentablemente pues tenemos una carga de
Sadly,
tuberculosis muy alta.
we have
Nuestra
a very
incidencia es de
high
120 a
amount of
123 por
people with
100.000
TB.
habitantes.
We are
Y
talking
no
about
tenemos casos, pero puede
123
ser
people every
7% de nuestros casos son
100,000 people,
MDR.
and
Y el 16% de los
most of
casos
them
reportados son MDR. Entonces
are
tenemos una
cases
gran
from
carga alta
MDR
en
TB.
tuberculosis resistente.
So as you can see,
Las
we have
personas
a
que
large amount of
están
resistant TB.
diagnosticadas, han sido diagnosticadas con tuberculosis, el
So from
61%
the
de
people who
ellos son
suffer
varones.
this disease,
Y
61% of them are
27%
males
de ellos tienen
and
edades entre 15 a 44
66%
años.
of them are
La
between the
epidemiología
ages of
en
15
Perú
and 44.
pues no difiere mucho de lo que se maneja alrededor del mundo.
I guess this is a number that also is very similar to other countries in the region. It's not just for Peru. Next slide.
Siguiente lámina, por favor. Gracias.
Thank you.
Bueno, nosotros en Socios en Salud hemos venido trabajando en todo
Okay.
el Perú.
We've been working, as I said, in all of the country, Peru, but we started working in Lima, in the north of the city. This is where we started our active search. As Karen explained, we've been working on this for more than 20 years, and this TB rate has been consistent in those years. Sadly, we haven't seen a decrease in this number. We haven't either seen an increase in the number, except for COVID season, of course, where we had more problems, but I'm sure all of you are aware of that. So this made us think about how can we improve this? It's not that we don't have TB cases. We just think that the strategy back then was saturated. That's why we decided that we needed new strategies with the using technologies so we can identify the cases at an early stage and we can start with the treatment. Next slide, please. Our strategies, well, we actually have two. We have TB backpack and TB mobile. We started with this in 3 areas in Lima. These areas in total had more than 1 million people back in 2018 when we started this. And we used our digital X-ray equipment using AI from Cat4TB. This allowed us to have a strong algorithm, and this can help us to do the treatments. As you can see, we have worked with other partners that are both from the country and also from the areas. Next slide, please. Okay, so we already know that the WHO in 2020 created this guideline on TB, right? So, as I explained before, we started in 2018 and we didn't have these type of guidelines before. So, this has been very useful for us to increase the activity that we have now. As you can see, the screening test is a step as well, and it's a recommended step when we talk about the x-ray, maybe not as a diagnosis at first, but yes, to have a fast screening to check who might have TB or not. Next slide, please. Here we have another study that was also very good for us so we can understand about the strategy. This study was done in Vietnam, and it was showing in the same way, in the different ways of screening somebody on TB, what was the best way. As you can see, doing an x-ray, chest x-ray, was one of the best options. Next slide, please. For our activity, we need, well, first, we need to get the community involved, right? Because we depend on them. This helps us to reach more people and also make them think that there is not a stigma when doing a screening, right? Because it's important. It's a disease that anybody can have, although it has a negative um, a negative impact, let's say, on people. So we just had some posters. We talk about the disease. We had some songs about this. We worked a lot with leaders in the community, with people that had already suffered from TB. Here are just some pictures of examples of what we did. Next slide, please. The steps for our screening, well, the steps for the algorithm are two actually. The first step is the screening, right? So for us, every person in the place that we go to, well, we only go to places where there is a lot of cases of TB, right? There are specific social factors that may allow or may contribute to this large amount of TB in that area. So for us, any person that spends time in that place is a potential TB person. It's a potential person with TB. So that's why the first screening we have, well, it's just asking them some questions, talking to them, then doing a chest x-ray with CAT4 TB, as you can see in the picture. And then we get a result from 0 to 99, and we can know if the scope is more than 50. This means that this person needs to have an extra step, needs to be seen again. Next slide, please. These are some pictures in our mobile unit. As you can see, this is the equipment that we use, that we have been using in the last couple of years. Here we have the technicians looking at the x-ray. We have a heat map that allows us to visualize where is the affected area in the lungs. Next slide, please. And then step number 2, as I mentioned in the first step, the person, well, most of them don't even have symptoms, right? For us, just anybody that works in that area can be somebody who has TB, right? So when they move to the next steps, we do
comienzan a
an
tener síntomas,
diagnosis
evaluación,
evaluation.
pues tenemos que
And
separar la
this is a
enfermedad
more
cuando
difficult
tenemos
aspect
como
because
preoperarnos,
sometimes people don't want to give
ayudar a
us
enderezar las
a
cosas, no hacer
sputum sample
visualización
for
en una
expert. So
condición
we need to do some
específica.
counseling, we
Lo
need to talk
tratamos de
about them,
apreciar vía física. Y
and we
luego
try
para
to do it.
tomar la muestra está
Once we have the sample,
analizada por el Laboratorio de Socios en
we
Salud
analyze
Perú del
this,
Norte. Hacemos una evaluación clínica de todas
we
las
do a clinical
personas y
evaluation of
todos
everybody,
han salido con este score alto y posteriormente pues
and
tenemos el
then
diagnóstico de TB o no TB.
we
A
have
las
the
personas que
diagnosis
son
whether that person has
diagnosticadas con
TB or not.
tuberculosis,
The
lo que
people who
hacemos
have
es
TB,
le damos como soporte,
we
lo
support them.
metemos con una agenda comunitaria para que
We
esta
create
agente
a
comunitaria de
community
salud
agenda
le
so
brinde
that
el acompañamiento
the
hasta el
entity
inicio
in
del
the area
tratamiento.
can provide the
Esa es
support and the
la
help needed
única
until the
finalidad,
end of
diagnóstico
the
y poder iniciar
treatment,
con
right? Because that is
tratamiento.
the main goal, right? Not only
Siguiente, por
ending the
favor.
disease, but also starting with the treatment. Next slide, please.
Aquí solo para recordar los criterios que
Here,
estamos
just to
usando
remember
y
the
por qué es
criteria that we have in the
importante realizar el
diagnostic
diagnóstico de
and
tuberculosis
why
porque
this is
tenemos un criterio
important.
radiológico,
We have a
tenemos un criterio clínico
radiology
que lo podemos
criteria,
hacer también
clinical
médico
one as
y
well,
el diagnóstico
laboratory
laboratorio,
as
¿no?
well.
Todos estos tres
These are the
nos
three
ayudan en los
things
casos
that we
diagnosticados de
take into
tuberculosis en la
account
comunidad
to
y esta
identify the
es la
TB
forma
cases.
eficaz de poder realizar un diagnóstico temprano en
This
casos
is a
agudos.
very good way to find an
Siguiente imagen,
early
por favor.
stage of the disease. Next slide, please.
Estos son los resultados del primer año.
So these are the
Nosotros
results from the first
llegamos
year.
a tamizar a
We were able to
58.58
screen
personas, que era el 91% de las personas que estaban en cola esperando. Como ven, esta es nuestra foto de un día
58,000
normal
people. As you can see in the picture,
esperando.
there is so many people
En promedio,
waiting
un
to get
10% de las
tested and
personas que
like
nos
to get the
termina de
screen.
pasar todo el
And
tamizaje.
of course, not
De
everybody
todo el total,
spends enough time waiting in line to actually get the
71%
screening,
era
right?
normal.
So
El
we can say that
83%
from all
realizaba
of that
menos de
amount of people,
93%
28% had an abnormal
porque
result.
tenemos personas que eran adultas mayores, niños,
We
luego
had
algunos
people
casos
that
donde
were
personas con
children,
un diagnóstico
elderly as
sanitario no
well.
pudieron dejar la muestra de esputo. De los expos realizados, el
And then
2%
from the
tuvo un expert
experts,
positivo, el
2% were positive,
14% de ellos una resistencia rifampicina,
14% had a
encontramos un
resistance to
26.3 personas
rifampicin.
con tuberculosis. De ellas cabe resaltar que un
And we have to
20%
say that
fueron personas que
20%
tuvieron una
of the
prueba
people
molecular negativa, pero
who
radiológicamente,
were positive for
clínicamente,
TB had a
epidemiológicamente era
test
tuberculosis. Entonces
in the
se le da como un
past that
diagnóstico clínico
was negative,
radiológico
but then the
para poder
specific screening
iniciarse el
for this
tratamiento.
was positive.
Como verán,
That's why,
el 83% de ellos
as you can
iniciaron
see,
tratamiento
83% of these
temprano.
people started
Estos
the
son los
treatment
otros dos
within the
indicadores
3 weeks.
que son
We have two
recomendados en
indicators that are very
estos
useful
estrategias de búsqueda activa, que es el
in
número
these
necesario a
active
realizar.
search
En el
strategies
primer año
that
teníamos
this is the number of people that should
1.4
be screened. So
diagnosticamos una
at
persona
first,
y
we had this number that every 100
aproximadamente
and
de cada 44 diagnósticos que
150 people
necesitábamos
that
tener
we
un diagnóstico.
evaluated, only one
Siguiente
had
lámina, por
TB.
favor.
Next slide, please.
Esto solo para mostrarles nuestro cuadro de tendencias,
Then
las
here we have
diferencias entre
the
los casos de
trends
tuberculosis
in the
entre
cases
edad
of
y
TB
sexo. Como
that have
verán,
to do
pues
with age
las
and sex.
barras
As you
nos
can
ayudan
see, the
a
bars
saber los
help us
tamizados. Entonces,
to
mientras
know
tenemos más tamizados
the amount
mujeres,
of
son las
people.
barras
It
moradas,
shows that we
y
screened
hombres
more people, more women
pero
than men,
las
actually.
líneas nos dicen las
But
personas
the lines
diagnosticadas. Entonces
tell us
tenemos
the
más
people who actually
ejemplares
have
de
TB.
varones que mujeres,
So
a
we
pesar
had
de haber
more
realizado pues
male
mujeres. Y esto tiene mucha
people with
relación con
TB,
lo que les expliqué
despite
inicialmente,
we
donde hay más
screened
riesgo de
more
varones a
women
ser
than men.
diagnosticados.
So this is why we say that this
Ello
is a
nos
disease that
llevó a
affects mainly
ajustar
men.
las estrategias de
So
involucramiento
this helped
comunitario
us
durante
to
el mes
adjust
involucrado,
the
porque
strategies that
necesitamos
we had
involucrar a
with the
los familiares.
community
Este es el
engagement
ejemplo de
because
la
we needed
muestra
to engage more
en
men,
donde
right? And that's
tamizaron
where
algunos lugares como zonas de trabajo
that's
de adultos
where
donde hay esas
screening
tribus,
on
donde
workplaces mainly for men became very important, or just areas in particular that where more men were present actually. Maybe a factory or gas stations, areas where there were only men, as I said. Next slide, please.
Y esto es, pues, bueno, los inconvenientes que tuvimos
And then these
inicialmente
are the
con
challenges that we
el
have
inicio
when we
del
started the
proyecto, valga la
treatment.
redundancia. Nosotros tuvimos esos inconvenientes debido a que
As you can
en
see,
Perú, pues
we had
teníamos ya
these problems or these
equipos de
challenges
suministro,
because
pero no eran del
Peru,
todo
we already
confiables en
had
todos los médicos de los
some
centros de salud.
teams
Poco a
that
poco
worked on this,
se
but this wasn't
aperturó una
really
nueva silla y esto
known
hace
by
que se pueda
every
conocer mejor.
health
Pero también
institution in the area.
nos ayudó
So
el tema de poder de que el propio ministerio tenga ya sus
something that
propios
helped us a lot was
equipos, ¿no?
that the Ministry of Health
Reforzar también el
got
equipo
their
de
own
plazas, como les
equipment and
comenté, que
started
a
to
veces
share
sí
them
fue
with
un
institutions.
inconveniente porque a veces la decisión entre ir a
Another
plazas
problem we had
específicamente
was
de saber si
that
usted tiene que iniciar o no el
sometimes
tratamiento, pues
the
allí estaba
trace
una
result
barrera
is difficult
que
because we
también
aren't sure if we have to
era
start with a
un margen de error
diagnosis.
que
Well, it
pudimos
depends on the
generar.
case as well.
Y finalmente los
And
casos que
finally,
son detectados, pero
the
por
cases
corte
that are
biológico, ellos también tuvieron un
detected
problema para los inicios de tratamiento que poco a
but
poco
not
también se han
with
ido ya
a doctor. I mean,
mejorando,
this
pues
was a
porque
problem at
digamos que
first
esto
as
es
well,
la
but we were able
complejidad que
to
hemos pasado
improve
este
this
año
as years
durante
went
la
by.
lucha,
But
pues
these are basically the challenges
frente a
that
la
we faced on the
enfermedad, ¿no?
first year. Next slide, please.
Esos son los tipos de radiografía que
Here
hacemos,
we have
es
the
este que
different
siempre les
type of
mencionaba también que
screenings
tengo
that we
acá,
have. We
que
have
es
the
la
TB mobile
simulación
and the
de
backpack TB.
facilidad dentro de una
As you
impresora
can see in the first
de un grupo de
image,
hidrógeno, entonces tiene
there
electricidad
is
donde quiera.
like a
En el
device
tema
for
de biología,
electricity, so
es
it
una
doesn't
máquina
need
portátil,
power,
nos
like
permite
it's
a través
like
de
an
gafas de
automated
sol
power.
muy altas, como verán,
And then we have the
salen de nuestra
backpack.
mochila y tomar la
As you
radiografía
can
y tomar
see, you
datos
can
que están
go to
postrados en
very
ellos.
to distances or
Dale a la
places
siguiente,
that
por
are
favor.
otherwise hard to access. Next slide, please.
Estas son las ventajas y desventajas de manera
Here we have
rápida.
the advantages
Para no demorar más,
the
como verán, pues
disadvantages on
tiene la
this.
facilidad
As you
de
can see, the truck
transportar todos
can
los equipos
transport all of
dentro
the
de un
material, all of
costal.
the equipment inside.
Por
Like that's
gusto
a very
podemos
good
llevar,
aspect of it,
pero
right?
también requiere
But
mayor
the
inversión
disadvantage is that, of course, this is a
digamos,
larger
previa para
investment
movilizar ese equipo.
and it's
Con la
difficult to
mochila tenemos que la
access some
mochila tenemos una
areas with
máquina
this truck,
portátil que
right?
se
And
pueda
with the
conectar
backpack, it's super easy
en
because
nuestro
it's just
caso, o
something
una
that anybody
máquina
can
ultra
carry
portátil que también
and
tenemos,
you can take it
que la
anywhere,
podemos llevar en
basically.
cualquier lugar, ¿no? Es mucho más fácil. La radiación es menos
Also, the
también.
radiation
Solamente
is
podemos
smaller
imprimirla,
as
pero
well,
tampoco es que
but the
muchas veces
problem is that
tenemos
we
tiempo,
cannot
¿no? Y
print
necesita
the screenings.
electricidad.
And of
Siguiente lámina,
course,
por
it
favor.
also needs electricity. Next slide, please.
Y ya para terminar,
And then just to
comentarles que
finish,
pues estamos ya hasta el
over the years,
2023, desde el
well,
2019
right now we are
hemos
in
hecho varias
2023, so we've
evaluaciones
had many
y esto
experience with
es
different types of people
una
and
tabla en la cual vemos las
us.
diferentes
And
poblaciones que
here we
tenemos.
have a
Como
table,
verán,
a
nosotros hemos
chart
trabajado
with the
con
different
diferentes
types
géneros
of
identificables.
population. As you can see, we
Hemos
have the
trabajado
trans
casos de
transgender
100.000 habitantes como
people who
100.000
have
hasta 14.500
around
habitantes. En estas personas hay datos
29% of
genéticos, los cuales
abnormal X-ray.
necesitamos
Then we
sacarlos
also
para
have
ingresar dentro de nuestro
uh,
grupo prioritario.
people who live with
Población general también
HIV.
está dentro de esta tablita, nada más de que es población general donde la tasa de tuberculosis
Here we
es
have,
igual
let's
como si
say,
fuera
all of the numbers, all of the
multiplicable
people that we have studied
exponencialmente.
over these
La tasa
last
de muerte
years.
con VIH está en un cuarto puesto. Y también algo que
And
hemos
then
analizado
something
es
else that we
pues
have
en
done
población que vive alrededor de nuestros
is
establecimientos de
we
atención.
analyzed
Ellos
people
también
who
presentan
live
alta tasa de
around
tuberculosis y
specific
nosotros
areas, right?
tenemos
Poor areas where they
casi
have
70%
higher
de ellos
number of
hospitalizados
TB.
en el caso de detección y población migrante, aunque está
And also
en
migrant
la parte baja,
people.
es alta también, ¿no?
Even
Para
though
comparar
it's
hacia
not a very
arriba
large
el
amount of
carga que
people,
ellos
it's
tienen
still a
para poder
significant
poderse
amount of people who suffer
desarrollar.
from TB.
Y bueno, eso sería todo, me parece. Siguiente lámina, por favor.
Okay, next
Para
slide,
ahora,
please.
esas son fotos de nuestras actividades.
These are some pictures
Siguiente, por
of
favor.
the activities that we have done. Next slide, please.
Solo para invitarles a ver
And
para
then I want to invite you to please watch this on Netflix. This is the story about us. I think it's going to be only this week on Netflix, so if you can and you want, please take a look at it. Thank you.